My name is Mary Carlile. I'm a retired physician. I live in Enid, Oklahoma. I spent most of my career at Baylor Institute for Rehabilitation, where I was recruited to be the medical director of traumatic brain injury. I did not have children, so I pretty much gave all of my time that wasn't devoted to my husband to my work. I worked very long hours, lots of weekends. I did a lot of advocacy work for survivors of traumatic brain injury. I used it as an excuse, I think, to not exercise, not sleep right, not eat right. I had a higher responsibility to my job than probably I should have. I became acutely ill suddenly. I had a horrible stabbing knife-like pain in my abdomen. I picked up the phone and called 911, and they took me to the emergency room where they quickly identified that I had acute, severe pancreatitis and that I rapidly was going downhill. I was at St. Mary's Hospital in Enid. The doctors there were preparing my family that they might have to use my advance directive, and this might be the time of my passing. My family was distraught hearing this, of course, and they considered me a fighter and said, well, Mary has lots of colleagues and friends and supporters at Baylor University Medical Center in Dallas, and so they called there. And Baylor was wonderful and with open arms said, we will gladly assume Mary's care. And so I started on a journey south on my way to Dallas. Just past Norman, the EMTs called my sister-in-law on her cell phone and said, she's taken a turn for the worse. And all of a sudden, she is requiring more oxygen, and we don't have enough to get her to Dallas. They had to get me to the closest hospital, and it was a godsend that they took me to Norman Regional Healthplex. They took me immediately and gave me the care that I needed.
Mary Carlile is one of the most special patients I've had in my career. She was on the ventilator by the time I saw her. She was in the middle of an acute MI, which is a heart attack, and basically was as sick as she could be.
They discovered that I had 99% blockage of my widowmaker to the heart, the left anterior descending artery, coronary artery, and so they placed a bare metal stent and opened that vessel back up. They followed guidelines that had been set out by the American Heart Association for people who were going to need surgery in the period of time around which they had their heart attack. I went through that procedure with flying colors, thanks to their excellent judgment, the fact that they knew the guidelines from the American Heart Association. I have not had any chest pain, and that's been over a year ago. And I wake up every day feeling grateful and asking God, why was I saved? What can I do to make the days that I have left count for something?
As far as I know, going back and discussing this with her, she was completely unprepared to the degree of coronary artery disease she had, and had no idea it was that bad. In retrospect, she may have had some signs, maybe tiredness and fatigue, the things that we usually attribute to just getting older and essentially ignoring those.
I would encourage every woman to identify your risk factors with the help of your physician and put together a plan to decrease your risk, because it's imperative to save your life. Be sure you know all of the potential warning signs of a heart attack. It can be such things as right arm pain, upper back pain, a flu-like syndrome, and one that I think is fairly commonly seen, and that's breaking out in a cold, clammy sweat. Know that that can be your heart. If you suspect it, get treatment and get it quickly, because the time interval between the onset of symptoms and when you get treatment is critical in saving your heart muscle and saving your life.
Write your own story.